I was watching a video actually, and I started noticing a trend video that a lot of healthcare workers are retiring and they're quitting the healthcare profession because they're overworked and they're underpaid. And they're underpaid to the point where, and it's like some of them are getting the pay, but they're not getting the pay because you got all those insurances, schooling they have to pay off. And so a lot of them are in debt and they're working. The average doctor sees probably about 25 to 40, 50 patients a day.
When it comes to scheduling, your doctor is no different than a mechanic or a hairdresser. And by that I mean, when you go to the hairdresser for a hair trim, they don't have time to do highlights. You're scheduled for a hair trim that day. And if you go to the mechanic to get your oil change, they don't have time that day to replace your brakes because you're only scheduled for an oil change. And so when you're scheduled for an annual visit, which is meant for preventative care to do things like pap smears and STD testing and basic birth control management, your doctor doesn't have the scheduled time to address a problem with you that requires a lot of time to work up and discuss and kind of come up with a plan for. And I know that's frustrating because you took a lot of time off to go to that appointment. You had to drive to the clinic. You had to wait in the waiting room probably longer than you thought you would. And then you only get a certain amount of time and you want to address all your problems in that visit. I get it. But there are 20 to 30 other patients who did the exact same thing and they have their scheduled amount of time to address their thing that they're there for. So if you have a problem, I recommend that you make a problem visit with your doctor so that you have the time to address that problem. An annual visit or a wellness visit, those things are for preventative care to make sure that we keep you healthy. But if you have a problem, you need a separate appointment. Just like if you want highlights, you have to make a separate appointment to discuss that problem.
And if you ever notice when you go to the doctor's office, they don't even be in there with you long. Like they don't really like back in the day they used to sit there and just really talk to you and get all the information. They get the medical assistants to do all of that. They'll ask you all your questions. They'll send a nurse in most times. If they have if they have a nurse that can handle you, you might just see the nurse. You won't even see the doctor. And if he comes in, he's just gonna say hi. They gave you the prescription, yeah, yeah, da 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 da, and da 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 da. All right, thank you, bye. And he's on to the next patient or she. So you got retired healthcare workers that's speaking out, telling the truth about the healthcare system. So I want to play this lady video and we can talk about it. So here she goes.
This point. So I am lucky enough to say that I'm retiring tomorrow. Tomorrow is my last day of my 10 years of working in a hospital, and I'm going to share with you some things that I really think you guys need to know as somebody who's been doing this a hot minute. My other video got kind of taken down, but I'm going to say it again. Do not put your name on the registry, okay? You can donate, share your life, absolutely, share your organs, but do not put your name on the donor registry. They took down that video, so I'm gonna kind of stuff it in here and see if we can keep going and maybe it'll slide.
Do not put your name on the donor list. And they took the video down. Wow. You know what? I learned that a long time ago. My mother was in healthcare for a very long time. And when I first got my license, she told me, I was like, when I was at the driver's license bureau or whatever, the lady asked me, she said, "You want to be a donor?" And I was like, "What's that?" And she was like, because I'm young, I don't know what that is. And she was like, "Well, what happens if something happens to you while you're driving, or you got in an accident and you wasn't able to be revived? You can donate your organs." And I was like, "Oh, that'll be," because she said you can save other lives, and I was like, "Oh, that'll be nice." And so I had to come back because it was they wasn't able to process me because at the time I needed another form of ID, and so they told me I had to come back the next day. So my mother asked me, did I get my driver's license? I told her I have to come back, but I wanted to get my license, and I was telling her, the lady was telling me about being, it was like a cool opportunity. Like if something happened to me, I can actually help other people and live on, like kind of because, you know, because I would be able to help them with like their heart, skin, because they take your skin too, because that's the largest organ on your body. You learn that because we work with the integumentary system. We learn that that's the largest organ on the body, which is your skin. So, and all beauty professionals should know that. And I was saying we got A, B, C students, but anyway, I digress. So my mother was like, "Don't you put your name on that list." She said, "Because I'm gonna tell you something. If something happened to you, they're not gonna fight for you. They're not gonna fight for your life. They're gonna pull the plug, and they're gonna come in here and take your organs." And I was like, "For real? They're not gonna fight? That's illegal." She said, "No, they need organs. They will before you know it, they'll be done pulled you out. They will pull you out that room. They're gonna take your heart. They're gonna take skin. They're gonna take eyes. They're gonna take kidneys. They're gonna take whatever they need because it's so many people need that, and they'll be on the flight. Miami, Florida, they trauma. They used to get in. I'm talking about that's why they doctors ain't no joke out there. Like if you got shot in Miami, you might survive. you 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 might defy odds. Little I'm talking about they out there making legs out of tissue. I mean, they because they got so much to play with. They got so many limbs. So many of our young people out there getting shot and killed. They get their driver's license. And I think, if I'm not mistaken, if you don't be specific, as you don't want to be an organ donor, they will automatically register you as an organ donor. A mother crying about her son and was saying, "Hey, this is my son. I don't. I'm trying to fight for his life," and the lady was really nasty, really mean. She was like, "We gonna take him out of here." It was just ugly, and so, but that they really be ready to get them organs. And true enough, it does save people's lives. I listen to people all the time saying, "Thank you for this person because they gave me a kidney." One of my friends, her husband needed a kidney. He had been waiting for a kidney for years. He had to move out the state he was in because he had to go to a more high crime state. I mean, because in a high crime city where he was more, where he could possibly be on the donor list and be more accessible to receiving a kidney. And he finally did get his kidney because, again, you have a lot of young people out here, getting caught up in the wrong thing, and they getting executed, and or they're dying, or they're on life support. And while they're on life support, they're trying to get their organs, because the thing is, once they're dead, they can't get their organs. They have to keep them on life support. So that's the sad part for the family, because they're like, he's literally on life support, and you still keeping them on life support, but they have to, because if they take them off life support and just let them die, the organs ain't no good.
Sending this to the news, I've asked you not to take my son off. I swear my son would have not wanted his organs removed. All of us, all parents are here. We said no. We said no. And ma'am, please, can I get the director, whoever is over Overland Park Regional? You just told me no, ma'am. Can you tell me no on this phone again? Tell me no again.
I am happy to find someone to visit.
No, I want to talk to who is ever in charge of this hospital.
Okay.
This hospital.
Okay.
And the attorneys that is sitting, that's saying that this is okay, that you said that they said this is okay.
You have documentation.
Ma'am, I am
Your son
I need
signed on
them
his
to come in
driver's
and
license
see. My
to be
son
an
did not
organ
want that. I
and we
signed when it was the
appreciate
money.
the gifts that
It's not,
giving.
he's not
That's
giving
all I
them.
have to say.
Yes, can you go get whoever's in charge? Thank you. He has siblings. They're not going to get to say goodbye. They never told us they were doing this today. Never. Never. For money. For money. For money. This is all about money. This is all about money.
Give him a big hug and kiss.
We're doing a victory walk.
It's an honor walk.
An honor walk. And y'all just notified us 3 hours ago. The family only gets a 3-hour notice. If this was y'all, wouldn't y'all want more than 3-hour notice of this? Don't we have the right to more than a 3-hour notice? 3 hours.
Give him a hug. Please take time to say goodbye to
Oh my
Avery,
God.
please. Give him a big hug. Just please.
Avery, they lied to us. They never told us they were doing this. They never. They didn't give us time for emergencies. They didn't give us time to get to the courts or anything. They just told us this 3 hours ago. 3 hours. We've been going back and forth about organs for 3 days. They did not tell us that this time y'all were going to be doing this. Then we got this Dr. Watts.
Do you want to say
And he just want to,
anything you want to say?
whatever. It's horrible. Oh my God. I said, can't believe this.
Oh my gosh, it's so strong. Just to know that it's in him, baby. I love it. I'm so glad that you're doing so well. It's strong. We are family. So whatever you need, you just call me.
Now I'm nervous.
It's okay.
Oh, my baby. Yes, it's there. It's there. But
They are trying to kill us with our food. They are. I'm sorry. I've been seeing 20-year-olds who are coming in with cardiac problems. It's not just the food, the energy drinks, the vaping, all of those things, guys.
Wait a minute, I'm sorry. She telling the truth. That's why I tell children all day long. My daughter, I had to tell her, stop drinking them monster drinks. Stop drinking those energy drinks and them just for energy drinks and those Red Bulls that give you wings. Okay, stop drinking them because it's it's too much caffeine for their heart. And you got young people drinking those energy drinks and they're exercising and running track and everything. It's just all kind of stuff and it's just too much for the heart. And Dr. Sebi said a long time ago, it's how we eat is killing us. And we have to improve our eating. I'm a victim of that. Like just working a fast-paced job, not taking time to eat, because I'm trying to get my clients in and out. So sometimes I pick the wrong choice to eat. Sometimes I don't eat at all. Sometimes I just go and get some processed rice or something, some Chinese food. You're trying to eat something to keep you going, but it's not good for you.
You know that they're testing the bread and the candies to see what kind of poison they're putting in it. And the reason they're putting poison in our food is because we have a for-profit healthcare system. They are trying to make us sick so that we spend our money in healthcare. How do you get cancer? How do you get any of these diseases? Diabetes. It's all on what you put in your body. We have to stop eating processed foods. Please stop vaping. Stop vaping. Cigarettes are, I think, better at this point than vaping. We were seeing people coming in with pneumos because they try and hit that cartridge too hard and they actually pop a lung. You have to quit vaping. That will send you to an early grave.
Wow. Wait, hold on. We need doctors because we need them to help us get well. But what are we, when we're going to the doctor, they're making us sick.
And they don't want us to get older because we're paying into Social Security, right? And they don't want us to hit the age where we actually will take it. What defense do we have at this point in this country? All we're trying to do is just live our lives. Always get a second opinion. I know. Anytime a doctor or anyone diagnoses you with anything, always get a second opinion. They might be the highest, best doctor in the thing. Always get a second, maybe even third opinion. Medical people are humans and they make mistakes. Please protect yourself. I love you. medicine, and I feel very grateful to have been able to work in this field. And I've learned so many things, and I've met so many amazing people. I'm really grateful that I got to go and wake up every day and help someone. That fills my heart, and that's why I do this. And I hope that more medical people feel the same way still. Have a great day, guys.
Let me ask a serious question. So why is so many healthcare workers staying quiet for decades, but once they retire, they start telling the truth about everything in healthcare? Doctors, nurses, techs, surgeons, people that's been 30 to 40, 50 years in the hospital, why they suddenly begin to share everything that they witnessed with their patients that people never heard. Things about diagnosis, things about prescriptions, um, organ donor lists. And so now let me be clear before we actually start, healthcare workers save lives every day. But a lot of them will tell you that the healthcare system has flaws. It's really about money because the sicker you are, the more money you're going to spend for medication. There's more to that organ donor list than you think. Most importantly, we're going to talk about 3 things you can do to improve your health and live longer. And I think everybody needs to do that. So I want your opinion. I know y'all going to have a lot to say because this is a very controversial topic because the healthcare industry, a lot of people today are complaining about the prices, um, the service that they're getting, from overworked doctors, nurses, staff, the treatment, and and a lot of people are just getting sicker and sicker. Some people, just had bad, awful experiences in the hospital. Back in the day, my grandmother used to have this big thing, like a heating pad, but it was like they had to put water in it, like hot water. And I think it was a heating pad and it was an enema. And so an enema is that they will put water and have it circulate and clean out your colon. And a lot of times when you used to go to the hospital, the first thing they would do was give you a colon cleanser. They don't even do that now. A lot of people aren't sick. They just probably need their colon cleansed because of all the processed food that we eat. I just want to know your opinions. Do you think we as a whole, especially in America, rely on prescription than prevention? Let me see it in the comments. And if you enjoy everything you hear and see today, if you love the conversation, you love how we get down on this channel, please remember to like, comment, and subscribe. And I want to hear, what you have to say. So leave it in the comments, please. Awesome. And we just thank her for her.
So I am lucky enough to say that I'm retiring tomorrow. Tomorrow is my last day.
So I hope she have a happy retirement. And thank you so much for your service. And thank you for being honest and telling the truth. You can really hear that you care. I try to tell my students, stop vaping. You don't know what you're sucking up. I've seen people have very chronic lung problems after vaping, where they can't even breathe. I met a young girl who told me that happened to her. She was like, "Oh my God!" I would tell anybody don't vape. And it was so funny because one day I looked outside and she was vaping again. I think sometimes young people, they just think they can defy it because she survived it. But I'm just like, I can't believe this girl just told me she almost died from vaping and all the struggle she went through, and she's out there vaping. But peer pressure and hanging with friends, and I mean, it looks cool. That's why people smoke cigarettes because it looks cool. But cigarettes are horrible for you. So let's get into it. So doctors in the healthcare profession make the best decisions they know how to make. I mean, yes, they go to school, but they're human just like us. And so when you go to the doctor's office, you tell them your symptoms. A lot of times you won't even see the doctor at that point. You'll see maybe a medical assistant, and they're gonna ask you all your medical history. So a lot of times they'll go after your medical history, and that gives them an idea of what to look for. So my grandmother had diabetes, but the thing is, I can't go off of my grandmother actually, because my grandmother wasn't my biological grandmother. She was my adopted grandmother, but she still was my grandmother because she raised me. But I couldn't go. I had to realize as I got older, I couldn't go off of her health care because that was not in my bloodline. So I had to go off of my bloodline. And to be honest, my bloodline is pretty healthy. Even all the raggedy stuff that they do to their bodies, they relatively, to be honest, people in my family, they have long lives. Like they just have long lives. My grandfather just passed. My grandfather was 89 years old. He passed 2 years ago. So when I go to the doctor, they ask me what's the history, and they ask me all these questions. And so like my mom, she is nothing. The people just like trying to figure out why she has nothing, and they tested her and everything, and she doesn't have. Like my dad, he lived a very reckless life, and the I'm talking about minute problems. My dad is mostly healthy, and so it's just some people have certain things in their family, so most of our thing was good health. I'm sorry, but it's the truth. And I think it's because growing up we ate a lot of fresh fruits and vegetables, even though we was like poor, what they call poor. We grew uh, the land. We were still able to eat mangoes, avocados, oranges, limes, grapefruit, aloe, peppermint tea leaves, tangerine. We had real chickens and turkeys in the backyard. I mean, we just had a lot of fresh fruits and vegetables. And a lot of times, as kids, I remember us saying, "We hungry," and they'll say, "Go out there on that tree and get you a fruit," because we had plentiful of fruit. So we grew up. Our hair was pretty, our nails was pretty. We was really healthy kids. Things were fresher then. Now we don't have that luxury. You don't get to go outside and pull off a tree. So a lot of times children grow up eating a lot of processed food, like McDonald's and pizza. All that stuff is acidy. And that's why a lot of children now have a lot of healthcare issues. Um, they struggle with obesity at a young age. A lot of these healthcare workers, they're used to seeing all these malnourished because a lot of them eat bad, but they're still malnourished. A lot of times you don't blow up. Some people blow up and some people still stay skinny, but just because they're slim doesn't mean they're nourished, if that makes sense. Um, Another thing retired healthcare professionals talk about is the prescription drugs. Do you know that the United States sells over 6 billion prescription drugs a year? Over? Like it's so many people, it's just pill popping, pill popping. They're making it's a killing. And while medications are needed for some people and they do save lives for some people, because I mean, yes, a lot of us need our high blood pressure medicine. A lot of us need our diabetic medicine. A lot of us need STD medicines, and they save lives and correct some issues. But often the prescribed medicine doesn't treat the root cause of why you are in the hospital in the first place. It's just a quick fix. And I had to be honest, I had to stop them from writing me medication. Like literally, I had a doctor every time I came to her, she was writing me an antibiotic. And I was just like, why you keep giving me these antibiotics? I just told you my head hurt. I mean, what is it? Like, I want some gut health. You just keep giving me, and to be honest, I think she was giving me the antibiotics so much to the point where they don't even do nothing for me no more. Because at first I was just taking her word for everything. But to be honest, and I'm not a doctor, and please don't do what I do. But sometimes when they gave me medication, I did not take it. I'm gonna be honest. I did not take it. Sometimes they wanted me to get tested for things that I felt like, no, that's not what it is. And I had to start kind of fighting back with them because a lot of them will do things just to do them, just so that they can get, I guess, credit for selling that medication. Because my teeth, I really suffered from a dentist I went to that basically wanted to just make more money. But it wasn't nothing wrong with my teeth. And he was basically doing extra stuff. Even with my kids, I was like, well, no, that's okay. They don't need no, they don't need any cavity. They don't have any cavities. And they were like, well, we just trying to drill it now before it get no. Don't no, we're not doing that. We not. So I have to stop them. And if the cavity that bad, we'll just wait till it gets to the point where she gotta pull it out. But what I'm trying to say is that what they do most times, often, if any, if you come in there with your problems, they're going to give you, by the time you walk out of there, you could come in there, for example, and say, I've been stressed, I've been having headaches, my kids are on my nerve, my husband is on my nerve, my job is on my nerves, everybody on your nerves. I didn't eat. All I had today was Starbucks. Let me get some. All I had was Starbucks today. Um, I picked up smoking. I smoke a lot now. I don't get any sleep. And so the doctor gonna hear that and they're gonna say, you need to be on some high blood pressure pills. You walking out of there with some high blood pressure pills. They was like, well, your blood pressure was a little elevated today. So we're gonna give you some blood pressure pills. Now, that might not be what you really need. You probably just need to stop drinking Starbucks, exercise, stop eating processed food, tell them kids to lay down and get some sleep so you can get you some sleep. Tell that man to leave you alone so you can get or that husband or wife to leave you alone so you can get you some sleep. You need to go outside and take a walk, get some fresh air, run, you know. But it's like if they tell you that, that doesn't resonate because we've become a pill society. So when they pop, it's like, I need a pill. That's going to fix it because I don't have the willpower to stop eating processed foods, and I'm not going to do it. And I'm not going to go outside and start running. And if I do run and exercise, I'm going to get me some McDonald's afterward, and I gotta smoke because why not? I like it. And I'm gonna smoke at least 10 packs right after I exercise. So they know you're not going to follow through, so they give you a pill, and so you get on this medication, you're taking these pills, but the it's not preventing the ailment. Every 6 in 10 adults in the United States have a chronic disease: stroke, obesity, heart disease, and diabetes. And I've been running into a lot of 20 and 30-year-old people having strokes, like strokes and diabetes. Now, think about this: your body is incredibly resilient. Just like I said earlier, my family is healthy. Your body is a machine, it's going to push through. But if you constantly put your body through stress of eating processed foods, smoking cigarettes, vaping, lack of sleep, stress, it's gonna start breaking down on you. Hospitals are often filled up with diseases that took decades to develop. Okay, it wasn't overnight. It took decades. And so, like, even now, I go to my doctor. I've been having symptoms of certain things, and I ask them, "Do I have this, or do I have to?" And they're like, "No, your numbers are good." And because my numbers are good, the average person might just keep doing what they're doing. But I'm changing my habits because I know my body. Even though they're telling me I'm good, I'm going to slow down on eating certain things or drinking these Starbucks every day. Actually, this is the first Starbucks I done had in weeks. And it was good, but I've been slowing down. I've been slowing down because of the sugar content of the drink that I like. I don't want to develop diabetes, so I don't want to develop all these things. So you have to listen to your body, So just start listening to your body and start taking care of yourself because you worth that. You got to be here. My motivation is not just for my kids, but for myself. And so I'm working on that. The donor list is really stressing a lot of people out because they want to be a good citizen and be a donor, but so when somebody's declared brain dead, their organs may keep functioning with machines until transportation. So that's why a lot of families like, well, they're breathing. I could feel the blood in their body. Yeah, they're still their hands still feel warm. They're alive. That's why people could sit on a life support for years. They're alive, but they're brain dead. So no activity to the brain, but everything else is still moving because they have to keep them functioning so that they can take the machines to transplant it. Okay. Hospitals follow real strict medical rules during this process. So this topic is very personal because no one wants to see their loved one that they thought was fighting for their life, pushed out by 15 people, knowing that they touched them their last time and they feel like they breathing and they move. You just feel like it's very hurtful. But some people strongly support organ donation, and I'm not mad at you because I know people like, hey, if I'm not breathing, if I'm gonna be a vegetable, let me go, and I respect that. But they don't want to be, not able to take care of themselves and be dependent and be what's so called like a burden on someone. They like, listen, if I can't wipe my own butt and I can't stand up and take care of myself, please pull the plug. A lot of family members, because they don't want to see you go, they're like, no, you still alive, I'm gonna let you try, I'm gonna try to fight for you. And some people are like, no, don't fight for me. I'd rather give my organs to someone. I'd rather just move on. I don't want to live a life like that. And I respect that. A lot of them make that decision because they've done research. They've seen what they do with the organs, like helping cancer patients and, helping, car accident victims and, people who was born without the organ or just, so it's all different type of reasons as to why people would need an organ. So they've done their research and they want to be a blessing to somebody else. And I love that. But before you decide to do that, I want to say that for someone that's very young, if you're watching this and you getting your driver's license, talk it over with your parents, get ready to do the research, understand the process of organ donation, talk it over with your family, let your family know, and not just if you're younger, just even as you're getting older, at any age, talk about this with your family. Tell them what you want. Like tell them, I don't want to be a vegetable. Take me off, okay? Or you say, well, I don't care if I am a vegetable. Fight for me. So it just depends on your wishes. And so always talk to your family about that. Everybody deserves to make that type of choice while they're able to make that type of choice. So if that's the choice that you want to roll with, just make your choice, let your family members know so that way when if that does happen, they say no, that's not what they wanted. They would like this. So things that we can do to improve our health, and I think we already know this: leave high processed foods alone, excessive sodium, even though sodium is the best thing for us, salt. Magnesium. It's better than sugar, but we don't need it in an excess. Sugar, artificial additives, and try to focus more on fruits, vegetables, whole grains, lean proteins, and healthy fats. Because studies show that diets rich in whole foods are linked to longer lifespans and lower disease rates. And third thing you have to do is move your body. Move your body with me. You got to do exercise, walk 30 minutes, stretch, cycle, even dance. Do your pop lock. It's good to exercise because it's good for your brain, it's good for your heart, it's good for your circulation, and it's good for your mood. Third thing is protect your lungs, okay, at all costs. So leave them vapes alone. Don't hang with people that vape because you're taking that secondhand smoke. Don't smoke, don't even get around secondhand smoke. Try to protect your lungs at all costs. Don't smoke. I was sick. I was in the grocery store, and it was amazing how I was just standing in front of that grocery store. I was asking for a money order, and I seen the sign on the in front of the cigarettes, and I was just like, they put this sign, but nobody pays attention to this sign, and it's basically telling you that cigarettes are bad, and so many people don't care. They want cigarettes. You gotta stop putting those pollutants in your body if you want to stay here, because you don't want to be trying to find a lung, and it's not cool when you can't breathe. Thank y'all so much. I appreciate you so much for hanging in there with me. Like I said before, if you anything you seen on here, if you have to comment on it, you're more than welcome. I love that you engage, please, and I love to engage back with you. So please like, comment, or subscribe to the channel. And I would even love to have conversations with some of you guys. So if y'all into that, let me know because I like to talk. But anyway, it's your girl, and I'll see y'all later. Bye.